in this period, well, tell us a little bit about your background, training, and experience then towards achieving your doctorate in physical therapy.
I went to University of Florida for my bachelor's. I majored in applied physiology and kinesiology. During that time, I also played collegiate lacrosse, so I had a very strong pull towards the body and whatnot. In addition to that, I also was very interested in chronic pain and helping patients that had experiences with depression resulting from chronic pain.
And after that, did you pursue any additional degrees or?
I received my doctorate of physical therapy, but in addition to that, I have increased specialties. I'm a certified brain injury specialist, a board pediatric specialist, and neonatal touch and massage specialist for premature babies.
Now, I want to take you back, if we can, to the summer of 2016. And at some point, you were Maya Kowalski's physical therapist?
I think it was 2015, yes,
15,
sir.
I'm sorry, 2015. Okay, you know this better than I do. And so I wanted to ask you whether you were the person that made the initial inpatient rehab physical therapy evaluation on July 31st?
I believe that was the date, but yes, I did do her initial evaluation with Maya, and her dad was there as well.
If it would be difficult for you to remember each and every part of this, or would it be difficult for you to remember each and every part of this without seeing it?
I would prefer to see it if possible, but...
Would that refresh your recollection?
Yes, sir.
May I approach you? Or we can put it up, I mean.
Well, if you've got it there, you can just approach.
That's right, I can't put it.
Thank you very much.
Was that the evaluation?
Yes, sir.
Okay.
Your Honor, just for the purposes of the record, can you identify what the base number of the date is that you showed?
I know it's 3047. Can you read on the bottom? It says exhibit 3047.
-1378.
Yes, and then the last page.
The last page says Defense Exhibit 30471384.
Oh, that's right. I was just reminded that we can publish to her and counsel, and that way I will know what I'm talking about.
You can do it by the paper or you can do it electronically, whichever way you want to do it.
Okay. So I want to take you through this a little bit, and we can publish to those that can receive it right now.
Wait a second. Are you showing a document that's in evidence or not in evidence?
This is not in evidence.
Okay.
Your Honor. It's purely for the.
So members, hold on a second. Okay, members of the jury, since the document's not in evidence, I'm turning your screens off. So that's the reason why you're not going to be able to see anything. You can proceed at this point.
So, tell us about the first time you met Maya.
Maya came in and her father was there. I can remember doing the assessment on the therapy mat in our gym. And overall, she presented with significant weakness throughout not only her legs, but her upper extremities, her arms as well. Maya had significant discomfort with movement through her knees and ankles. In addition to that, she was very apprehensive in regards to someone else initiating movement due to the significant discomfort.
Now, through this examination, from time to time, the jury will see Maya moving her arms and legs. But in terms of CRPS, paralysis is not one of the elements, is it?
No, sir. And
She can move. I'm sorry.
No,
I
I'm sorry.
interrupted you.
I was just saying, and it can be very inconsistent, the presentation, just due to the symptoms that are experienced day by day.
And did you observe this throughout the time that you took care of her?
Yes, sir. There were days where she felt much better than other days, and the days that she wasn't feeling well, she really did struggle and experience discomfort during her sessions.
Okay. I'd like to show you what has been marked as Trial Exhibit 2529-035. And this is in evidence, Your Honor.
Is in evidence?
It is in evidence.
Mr. Rice, take down the other document first.
Yes, sir. Just a moment.
Yeah, it says 035, 25, 2903. I think it's,
Yes.
okay. Now, when you first saw Maya, this is a photo taken right around that date. Did she appear to be in significant, well, maybe this was later because she's got the boots on.
Just later.
Did she appear to be in significant pain?
Yes, sir.
And what were the ways, can you tell the jury, you could tell that?
She was 9, so crying, saying that she was in pain. Occasionally, she would writhe in pain. And just the fact that she was limited from doing the activities that a normal 9-year-old would want to participate because she was nervous about experiencing increased discomfort.
So did you observe instances where you would move to touch Maya and she would shrink away or otherwise react?
Yes, sir.
Did she have good days and bad days?
Yes, sir.
Okay, take the jury through, if we can, your initial assessment, what you did, how you did it.
Well, first I wanted to get to know Maya, so I would ask her questions about previous to this exacerbation or the hospitalization, things that she enjoyed. She was very quick to tell me she was going into 4th grade, but it was much more like going into 5th grade because she was in advanced. And she just showed her personality like any other 9-year-old during that. And then from there, I did a range of motion assessment, seeing how much she would let me move her hips, her knees, her ankles, while monitoring her for pain. And then in addition to that, I did a strength assessment of those various muscle groups throughout her hips, knees, ankles, etc. The way that we split up with our therapy in that facility was PTs would typically take a look at the lower body, so legs essentially and trunk, and then OTs would focus on what's more called fine motor skills, so more the hands and the arm movements. So in addition to that, each evaluation with patients at TGH, I would look at their ability to perform mobility, so rolling, sitting, seeing if she could stand, walk, and transfer from an object like a bed to wheelchair, wheelchair to mat, etc. And then just looking at the assessment here, just because it has been 8 years, it looks like she was able to have trace movements through her legs. So if you think of, if you were to go do like a bicep contraction where you feel the muscle, but not necessarily active movement, that was happening around in her ankles, where you could kind of feel the muscles going like they wanted to, but they were inhibited by the discomfort and the pain. And then some hip movement, like able to move through partial range, but not against gravity. So if you think of, if you were laying flat on a bed and I asked you to, well, sorry, that one is a 1, so never mind. If you were laying on your side on a bed and I asked you to kick your leg, she would be able to move that a tiny bit, but if I asked her to lay on her back and kick up, she was unable to do that. So that's called anti-gravity movement. So did that answer your question? I'm sorry.
Okay, well, I wanted to then show you, well, let me ask you, did you then begin your inpatient therapy?
Yes, sir.
And can you remember everything that went on in that, or would you need assistance to do that?
I mean, by everything, you mean 24/7, I would need
Yeah,
assistance.
everything you
Yes,
did.
sir.
Would this refresh your recollection?
Yes, sir.
May I approach?
Why don't you tell Mr. Shapiro or
Yes.
show him what you're going to show the witness?
As previously. May I approach, Your Honor?
You may.
Thank you.
So let's tell the jury, that was almost the same day, or was it the same day that you did
The day that I met her was the day that I did the initial evaluation.
and so then this was the first actual visit?
Yes, sir.
Okay. Explain to the jury what you did and how she reacted to that.
So I overtalked the first round, so I apologize. So I did the strength assessment, the range of motion assessment, and with that, she was experiencing discomfort, especially through her ankles and knees. So I was unable to get her to her full range of motion of her ankles. So if you think of standing up, how your feet are able to go into kind of a 90-degree angle, she was unable to achieve that because she was so limited by pain. I do recall that she was tearful during this first time, which is fairly common because she's in a new environment and you have people that you don't know or trust yet moving you, and she's experiencing pain.
Let me then, so how long did the physical therapy last?
That session or for,
Yes, ma'am.
I'm going to look at this real quick. Usually they were about 45 minutes. It was 30 minutes for the evaluation.
Got it. So let me show you then, and this is in evidence, Your Honor. Well, let's make sure I got the right one here. This is in evidence as 2529-025. And if we could display it, Your Honor.
Yes, you may.
So you should be able to see it there. And I'm old school with it. Okay, I will, for the record there on the bottom left-hand corner, there is a timestamp, and what is that? Can you see?
August 6, 2015.
Okay. And so this was what, about a week after you started? 8 or 9 days?
Yes, sir.
Okay. How was Maya doing around this time? I see she's not got boots yet, but tell the jury what you were doing with her and how she was doing.
So over time during that week, it came to my attention that she had significant discomfort with weight bearing through her legs, so standing up, putting weight through her feet. So I tried to change up the activities to enable her to elicit some leg strengthening to the best of our abilities with making it as less painful, to decrease the pain as much as possible. So in this particular instance, what I'm doing is I positioned a table with a fun game off to the side to enable her to lean to the side to elicit what's called a righting reaction or an equilibrium reaction. So basically, with that, if you were to get kind of pushed over to the side, the first thing that happens is that your trunk engages, and then by that means your hip and leg will contract as well. So I was able to get her to strengthen through her quads and her hips and her trunk muscles in a way that decreased pain and decreased fear as well, because it's critical with pediatric patients to make it a comfortable environment and to build rapport with them as well.
So let me then show you trial exhibit 2529. I can't see the last numbers. This one, can you all make that out?
23?
It's hard to see on here.
Is it 23? Yeah, it's 23, Greg.
23. And it's in evidence, Your Honor, may we publish it to the jury?
You may.
Well, it looks like we have. Okay, so here, explain what's going on, what's she trying to do?
I don't believe this was my session. However, this is called an upper body ergometer on our Motomed unit. So I believe what was happening here was that she was using the arm cycle to help get movement through her arms, to help with blood flow, help with strengthening, etc. You can see kind of with her hand placement there that she wasn't able to fully grasp it due to pain, due to weakness. But I believe that this session was focused on that to just try to help with endurance in any way possible, as well as seeing what strength we could get.
Now, had you seen that expression on her face previously or after?
Yes, sir.
Is that an indication from your experience with Maya that this was a what you would call a bad day.
Yes, sir.
And on those bad days, was her ability to be touched affected?
Yes, sir.
And how about her overall presentation? Was she, appearing to be less functional on those days?
Yes, sir.
What did you notice on the off days then, that overall about Maya's attempts to recover?
They were limited. She was experiencing pain, she was sad, she was frustrated, and that had tremendous impacts on her abilities to participate.
Okay. And then I'll show you what's, let's see when that one is. I'll show you one more. It's on trial exhibit 2529-026, and it's dated August 10th. It's in evidence. May it be published?
If it's in evidence, yes.
Okay, so again, you can see on the bottom here, it's 8/10/215, around the same time. And what are we trying to do here? Particularly, what is that on her legs?
Okay, so she's in a Riften gait trainer, and on her legs, it looks as if we have the PRAFOs, PRAFOs on their positioning devices for the lower extremities. And because she had the weakness and that fact that she couldn't really achieve that neutral positioning through her ankles, we wanted to make sure that her ankles were well supported so that we wouldn't experience ankle sprains with weight-bearing activities, so putting weight through the feet. So if you think of kind of like a rollerblade or a ski boot, it helps secure laterally to prevent her ankle from rolling. And then she's on a weight-bearing support harness, and then she can weight bear through her arms through those upper extremity supports as well.
All right, well, close then to that time, let me show you, I want to get into the boots.
Yes, sir.
When Maya arrived, did she display dystonia? And you're from, obviously, with the feet turned in?
Let me
This is
consult.
before she started with you.
Right. I remember that she definitely experienced plantar flexion where they're pointing down. I'm just going to look at this real quick. And she was unable to tolerate foot flat positioning and sitting. With that, so, yeah, so her feet were definitely pointing down.
Okay, let me show you then what's been marked as trial exhibit 2529-031. A few days later, August 8th, 2014, may be published.
Is it in evidence?
It's in evidence.
Yes.
Okay, now what's on her feet here?
Those are those PRAFOs that I mentioned before.
Did she like those or not like those?
She did not like those.
She complained they hurt,
Yes, sir.
but what were they designed to do?
Prevent injury and prevent further contracture development. So she did not like them, but I did not want her to get injured. So it was the lesser of two discomforts.
Right. Was her foot then trying to turn one way and the boots were holding them another way?
Yes, in a more neutral alignment.
Now, by this point, had it become clear to you whether Maya was sincerely trying?
Yes, sir.
Okay. I'd like to show a short video from that same day, exhibit 2658. It is a video of August 14th, 2015, and we'll play it, and then I'd like to have you then tell the jury what your impressions are, what was going on by this about midpoint.
Yes, sir.
May we publish?
You may.
Kowalski. You didn't even move 5 inches. Come on.
You can do it. You can do it.
Move. Come on.
Come on, righty.
Giddy up.
There she goes. She's
Giddy up.
Giddy up.
Hurry up. Come on, hurry up.
There she goes.
Come on, giddy up.
You gonna help right there?
Getting up.
Okay, come on, left.
Lefty, come on. Let's go. We're gonna have mommy. Come on, you'll get a break. You don't believe me? Well, too bad. Let's go.
Come on, left. Come on, bring her forward, bring her forward, bring her. There it is. That was great, Maya.
Come on, Daddy.
What is this going on?
Come on, come on.
Love it.
Come on, go.
Yeah. Very good. Very
Job, Maya.
Go, Lefty.
Very-
Giddy up, Percy.
good. Giddy up, Percy.
Giddy
Come
up.
on.
You don't believe me?
I do.
Come
Let's
on.
go, let's go.
Good, good, good.
Woo!
Good.
Good. That's it. Maya, that's awesome.
Very good.
Okay.
You almost by mommy. Almost there.
I was gonna tilt her that way.
Yeah.
There we go. Here we go. Whew.
You both are getting a workout, aren't you?
Yes.
Do you want me to put the stool close by you, Marissa?
You know what? We are almost here. Well,
Okay,
I can
okay.
make it. I can make it.
All right.
We can make it. Let's go, Lefty. Come on, Lefty.
Go.
Come on.
Come on.
Come on, Lefty. Just go forward. Go forward.
Okay, pick it up. Good.
That's straightened on your own.
That was good.
Can you press up a little bit for me?
Giddy up, Percy. Go.
There you go.
Come on, righty.
Come on. You're doing
Toes
it.
forward. Toes forward. There you go. All right. Come on, Lefty.
Come on. Move it. It's not going. What's my fault?
You got it. You got it.
Talk it to it. Come on, you gotta talk it out.
Go. Go, go, go.
You got it. You got it. Nice and tall. Nice and tall.
Spank the horsey on the butt.
There you go. There she is. Nice job. Sorry, Maya. Trying to get the best position here. Here you go. You got it.
Go. You delete it right after I see it.
Okay.
Nope. Toes forward. Toes forward. There you go.
Good.
Job.
All right.
There we go, Maya.
Done.
Done?
Oh no, we have 5 more feet. Here we go.
Go, go,
Come on.
go. Go.
Come on, Maya.
Come
Bring her
on.
forward. There she goes. Keep going. Keep going.
Pull it up.
There we go. Pull, 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 pull. You got it. Kick, kick, kick.
Pull it up. Good. Pull it up. You're almost there. Almost.
She's coming. Come on.
Oh, yeah, yeah, yeah.
There we go.
Oh, very good. Very good. Keep going.
Keep going. A little bit further. A
Kick
little
it
bit
up.
further. Kick, 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 kick.
Kick to the
I
front.
can't do it anymore.
Are you sure?
Are you sure?
Can we try one more step? Okay.
Okay.
Okay, a few questions. First, does this indicate that Maya was, in your opinion, trying as hard as she could?
Yes, sir.
Okay. Now, who took the video? Do you recall?
Yes.
Who was that?
Maya's mom, Beata.
Okay. I noticed that Maya, when you were walking with her, her shirt came up a little bit and she immediately pulled it down. Was she pretty, as a 9-year-old, I guess, was she pretty body conscious in terms of displaying? And
I believe so.
well, you weren't standing in front of her, obviously.
Right.
So, okay. Now let's talk about Beata. She was encouraging Maya during the times that she was there?
Yes, sir.
How often was she there? Or is it mostly Jack? I don't know.
It was a combination of the two. I don't know the exact number of sessions I worked with Beata, but I do know that I met her multiple times.
And did you have an opportunity to speak with her?
Yes.
And did you have an opportunity to explain Maya's progress?
Yes, sir.
And through the course of your back and forth. Can you tell us whether Beata appeared to be normal? Like, that's a bad word. Whether Beata was first conversant with her daughter's condition, she knew what it was and challenges.
Yes, sir,
Okay.
yes.
All right. And had you been involved in terms of working with a lot of parents before this?
Some parents before this, yes,
Okay.
but lots since.
All right. Well, based on your experience both before and after, was Beata acting appropriately under those situations?
Yes, she appeared to be a loving mom that was invested in the health of her daughter.
Okay. And did she have any hesitation to encourage Maya, as we saw there?
No, sir.
I'm going to show you then Exhibit 260, and I'm not sure again. Oh, this is another video of August 27th, 2015. But before we do that, I just showed you that about, I think, the midpoint. So by the midpoint of her therapy, how is she doing?
There were good days and bad days, but as you could see in there, that while it wasn't necessarily pretty or how we walk, we were at least able to progress to the point where we could get upright, that we could try to get more and more weight bearing through the legs and trying to progress towards the activities of daily living. So I would say from that July 31st date to that, I believe it was August 14th date,
Right.
that there was progress. Yes, sir.
Was this a difficult case?
Yes, sir.
Okay, for a variety of reasons.
Yes, sir. She had a lot of pain and discomfort.
Right. And so then, did you continue with the boots throughout the remainder of her time there?
During that time, I believe I had a discussion with Beata during one of the first sessions where I had met her, and she had asked about the boots for positioning. And from there, we developed a schedule for her to wear them throughout the day as tolerated. And then she would wear them as tolerated during therapy sessions.
Okay, I want to go back to an exhibit we've previously shown the jury, but I think I had the timing wrong. This is trial exhibit 25229-035. And I believe the date of this is approximately the 20th or so. Were there days where Maya had an extremely difficult time with the therapy and wearing the boots?
Yes, sir.
And during those days, would she be allowed to recover a little bit?
I think with that, I think it depended largely on the therapist. For inpatient rehab, she had to have, I think, about 3 hours of therapy each day. So that would usually be about 2 PT sessions, 2 OT sessions. So I think it was largely dependent on each specialist that would see her. I can speak for myself, where if she had a more difficult day, that I would try to focus on the things that we could accomplish versus the things that would cause more discomfort and trauma.
So was this inpatient care?
Yes, sir, inpatient rehab.
So she was there at the
She
hospital?
was living in the hospital at this time.
And were her parents constantly there to support her after, and the times when you weren't in therapy, I don't know if you know or not, but from what you saw, were her parents consistently with her to try to support her, one or the other?
I think they were there as much as possible. I know that she had a younger sibling at home as well, and they had jobs. But I would say in comparison to maybe some other patients that I had, her parents were there more frequently.
Okay, now I'm going to show you a video a little later on towards the end there. And it's exhibit 2660. It's taken August 27th, 2015, excuse me, and it's in evidence. May we play it, Your Honor?
Yes.
It's short.
Oh, nice to see you. Nice job. You got it, you got it. Whoa!
So by the end here, had she made some progress?
Yes, sir.
All right, so it looks like she was using her upper body fairly well,
Yes, sir, and her trunk.
but were you able to get her out of the wheelchair?
I think for that session, I think there were some sessions that I focused more in sitting. There were sessions that I focused more in standing. So I think with that one, I was trying to play as well for strengthening.
I'm not so worried about the therapy part is.
Yes.
The fact that by the end of this, despite your best efforts, was Maya still in a wheelchair?
Yes, sir.
She still could not stand?
Not without copious amounts of assistance.
And so soon after that, her stay ended?
Yes, sir.
And so overall,
Pardon me.
then, from your perspective, having worked with her for a month inpatient, was Maya Kowalski suffering from any unusual or difficult personality traits that made you think perhaps there was something wrong mentally?
Object beyond the scope, and that's the objection foundation, and lack of foundation.
Beyond the scope.
I'm gonna sustain it.
Let me rephrase.
Yes, sir.
What, if anything, did you notice about Maya Kowalski's mental status in terms of friendliness, outgoing, and ability to relate?
Maya was a highly motivated, intelligent young woman who was eager to participate as tolerated. She was friendly, she would laugh, she had similar interests to other 9-year-olds her age. I would say in comparison to other 9-year-olds that I have met, besides being maybe more intelligent, she is fairly similar.
Was she in the Hopkins stage yet, or was that later?
I don't understand.
A little bit.
Okay.
And Beata Kowalski, from your interactions with you, was there anything that put you on guard that perhaps there was something, ulterior motives, or something going on with Beata Kowalski that concerned you?
Objection beyond the qualifications of this witness.
Like,
I'm gonna overrule the objection, the answer stands.
No, sir.
one moment, Your Honor. Make sure I do my job. Your witness. Should I even try to repair this?
Yeah, that's fine.
Did it just get worse?
Hey, good morning.
Good morning.
There's a lot of dates thrown around this courtroom, so I'm going to try to orient you. The time for which Maya was at Tampa General was July 31st, 2015 through August 26th, 2015.
He just said the 27th a second ago.
Okay, I'll show you the record, I promise you.
Yes, sir.
Okay, all right. So I'll represent to you that she was admitted on July 30th, 2015, okay? This is not yet in evidence, although I suspect it will be. But I would ask,
Move to strike editorial.
this is not yet in evidence, but it would help to refresh your recollection if I showed you your therapy note from the first day that you saw her.
I have it right here,
Okay,
but yes, sir.
Well, wait a second. If she has it, then I don't have to
okay.
do the,
So your first note was the first full day of the hospitalization, July 31st, 2015, is that right?
I believe that to be true.
Okay. Do you have at the bottom what's labeled defense exhibit? Well, is the first page of your note show a note that says inpatient rehab physical therapy, today's date 7/31/2015, defense exhibit 440? Is that your first page?
My first page, can I give you the bottom numbers of it?
Sure.
Okay, Defense Exhibit 3047-1378.
Okay, so we're on a different page. Your Honor, if I could have Clay published just to the witness, 30470440, please.
You can put it up now.
Okay. This is your note? Okay.
Yes, sir?
Okay. The referring physician is Dr. Kornberg, correct?
Yes, sir.
And who is Dr. Kornberg?
He was a physiatrist at Tampa General Hospital.
Okay. Is he sort of overseeing your therapy?
He's our referring doctor, and we would update him.
Okay. Let me, Clay, if you could go to Defense Exhibit 3047-442. And then part of your therapy sessions, you would make notes about how Maya's doing, is that right?
Yes, sir.
So let me direct your attention to where you have a comment under Other. Do you see that?
Yes, sir.
Okay. You wrote that Maya was unable to isolate contractions during testing, but demonstrated increased functional strength when performing activities subconsciously.
Yes, sir.
So let me ask you this. When you asked Maya to do something, is it true that she told you she couldn't, but when she was distracted, you noted that she could?
I don't believe she told me she couldn't. I think what happened with that is that when you try to isolate a muscle, it is hard to physically do it. However, when you're able to overpower with momentum or able to do it when it's a bigger, more integrated task within the body, it can occur.
Okay. You noticed that Maya was able to do things subconsciously, had greater abilities subconsciously at this visit than when she was conscious of it. Is that true?
Objection overruled.
With that, it was like what I was explaining earlier on the therapy ball, when working on things like writing reactions, which are reflexes within the body, reflexes are able to be elicited more readily.
Okay. Let me ask you about, and you were her therapist throughout the whole hospitalization.
On the days that I worked, yes, sir.
So let me ask you about a note from about a week later on August 6, 2015, and that will be Defense Exhibit 3047-344. You list comorbidities for the patient. What do you mean by comorbidities in general? What's a comorbidity?
Comorbidities are just things that you're experiencing. So it can be pain, it can be decreased range of motion, things like that.
What did you chart as a physical therapist? You have to also chart what might be a barrier to discharge. Is that right?
Yes, sir.
And what did you chart on August 6, 2015 as a barrier to discharge?
It appears that I put attitude of family, attitude of self, comorbidities, but these were links that carried over from other therapists as well.
Okay. So is what you're telling this jury, both from other therapists and what you put in, that one of the barriers to Maya going home was the attitude of Maya and the attitude of her family?
In terms of limitations due to pain.
Okay. And then let me ask you about another record that you wrote on August 11th, 2015, which is at 3047-288. Again, just turning to the part where you were doing transfers, you also noted that there were inconsistencies during treatments when asked to perform weight shifting with the trunk. Is that right?
Where does it say this?
On the top part where it says patient demonstrated inconsistencies during treatments when asked to perform weight shifting with the trunk.
Yes, she had good experiences, bad experiences.
Okay. Well, you also wrote on the next section, wheelchair training and management. You wrote, you attempted to perform wheelchair training during physical therapy. Maya demonstrated difficulty using bilateral upper extremities to propel wheelchair forward despite being able to maneuver her wheelchair around obstacles previously. Is that right?
Yes, sir.
Okay. And then on on the next page, 289, again, one of the barriers to discharge was attitude of family and attitude of self.
Again, this carried over.
And then again, let me ask you about 247. Actually, let me ask you about, let me ask you about 145 and 146. Let's start at Defense Exhibit 145. So again, you were asked a question about mom being present
Yes,
during
sir.
your therapy. Do you remember a time when mom was asked to leave the hospital?
I do not recall that.
Okay. Do you remember psychiatry or psychology be involved in that decision?
I don't remember the decision in which you're speaking of.
Okay. Do you remember whether Tampa General also put Maya on video monitoring?
I do remember that.
Okay. Were you part of that decision?
No, sir.
Do you remember why?
I believe she had an instance where she fell out of bed and they wanted to make sure she was safe.
Okay. Let me ask you, so we'll just fast forward to the end because it looks like you were her therapist all the way through. Actually, I'm going to ask you about one more note and then we'll get there.
Yes, sir.
Let's put up Defense Exhibit 3047145. And I'll represent to you, this was a progress note on August 21st, 2015. This is your note.
Yes, sir.
Okay, so Clay, we'll go to the bottom where it says other. You wrote, patient stood in standard for the duration of physical therapy, that she participated in games involving her bilateral upper extremity coordination as well as reaching. She demonstrated improved tolerance to standing as well as weight. And then if, Clay, you go to the next page. 146. And at the top, with weight bearing throughout her bilateral ankles, Maya did not report increased pain or discomfort in the ankles through the entire session, but when the patient's mother entered the gym, her complaints of pain increased in frequency. Is that right?
It appears to be so.
Okay. And then you were her therapist on the last day of discharge, so we'll go to 3047-73. And just one last question for you. Again, you said it carried over right through the day of discharge. Tampa General in their therapy notes, including yours, wrote one of the barriers to Maya going home was the attitude of the family and the attitude of Maya. Is that right?
It appears to be so.
Okay. One moment here. You recommended Maya continue with intensive physical therapy after discharge,
Yes, sir.
and that would be important for somebody like Maya.
Yes, sir.
Okay. Do you know how often she went to physical therapy after she left?
I had no contact with Maya since the day she discharged.
Okay.